Have you been feeling more tired lately? Do your ankles seem a little puffier by the end of the day? Or maybe you're waking up more often during the night to use the bathroom. Many older adults brush off these changes as nothing more than getting older. But what if some of them are actually early warning signs that your kidneys need attention? Your kidneys work around the clock, filtering waste, balancing fluids, and helping control blood pressure. The surprising part is that they can lose a significant amount of their function before obvious symptoms appear. That means small, easy-to-miss changes may be your body's first request for help. In today's video, we'll explore the first kidney warning signs that many people mistake for normal aging. Some of them may surprise you because they don't always start with pain. We'll also discuss simple habits that can support kidney health and explain when it's important to speak with a healthcare professional. Remember, having one of these signs does not automatically mean you have kidney disease. Many common conditions can cause similar symptoms. But recognizing these changes early gives you the opportunity to seek medical advice before a problem becomes more serious. Let's begin with one of the most overlooked warning signs, persistent fatigue, and why it may have more to do with your kidneys than you realize. One of the earliest kidney warning signs is a type of tiredness that doesn't improve, even after a full night's sleep. Many older adults assume they have less energy simply because they are getting older. While some slowing down is natural, constant exhaustion should never be ignored. Healthy kidneys do much more than remove waste from your body. They also produce a hormone that tells your bone marrow to make red blood cells. These cells carry oxygen throughout your body. When the kidneys are not working properly, they may produce less of this hormone. As a result, your body may have fewer red blood cells, a condition called anemia. With less oxygen reaching your muscles and organs, even simple activities like walking, gardening, or climbing a few stairs can leave you feeling unusually tired. Imagine two neighbors who are the same age. One still enjoys morning walks, while the other feels worn out after making breakfast. Although many factors can cause fatigue, including poor sleep or certain medications, kidney problems are another possibility that deserves attention. If you've noticed ongoing tiredness along with weakness, pale skin, or shortness of breath during everyday activities, it's a good idea to discuss these symptoms with your healthcare provider. A simple blood test can often help identify whether anemia or reduced kidney function is involved. And fatigue is only the beginning. Another warning sign often appears in the bathroom long before people realize their kidneys may be struggling. Now, let's talk about one of the clearest clues that your kidneys may not be working as well as they should: changes in your urination. Many older adults expect bathroom habits to change with age, and while some changes can be normal, certain patterns deserve a closer look. Your kidneys constantly filter your blood to remove waste and extra fluid, turning them into urine. When the kidneys begin to lose function, this process may change. You might find yourself waking up several times during the night to urinate, passing either much more or much less urine than usual, or noticing that your urine looks unusually dark, foamy, or cloudy. For example, imagine waking up 3 or 4 times every night to use the bathroom. You might blame aging or think you simply drank too much water before bed. But if this happens regularly, especially along with other symptoms, it may be worth discussing with your healthcare provider. Foamy urine can sometimes be a sign that protein is leaking into the urine, which may happen when the kidney's tiny filters become damaged. It's important to remember that urinary tract infections, enlarged prostate, diabetes, and certain medications can also cause changes in urination. That's why proper medical evaluation is essential rather than guessing the cause at home. In the next part, we'll discuss another warning sign that often appears quietly, swelling in the ankles and feet, and what it may reveal about your kidney health. Have you ever taken off your socks at the end of the day and noticed deep marks around your ankles? Or perhaps your shoes feel tighter than they used to, even though your weight hasn't changed. Many people think this is simply a normal part of getting older. However, persistent swelling in your feet, ankles, or lower legs can sometimes be an early sign that your kidneys are struggling. Healthy kidneys remove extra salt and water from your body, helping keep your fluid levels balanced. When they are not working as well as they should, excess fluid can begin to build up. Because gravity pulls fluid downward, the swelling often appears first in the feet and ankles, especially after standing or sitting for long periods. Imagine filling a sponge with more water than it can hold. Eventually, the excess water has nowhere to go. In a similar way, when the kidneys cannot remove enough fluid, your body may begin to retain it. Yet this can make your shoes feel tight, leave sock marks on your skin, or cause your ankles to look puffy by evening. It's important to remember that swollen ankles are not always caused by kidney disease. Heart problems, poor circulation, certain medications, liver disease, and even long periods of sitting can all lead to swelling. That's why it's important to look at the whole picture rather than focusing on one symptom alone. If you notice swelling that lasts for several days, becomes worse over time, affects both legs, or is accompanied by shortness of breath, sudden weight gain, or changes in urination, don't ignore it. Contact your healthcare provider promptly so the underlying cause can be identified. Simple daily habits may also help reduce swelling. Staying physically active, avoiding excessive salt in your diet, elevating your legs when resting, and following your healthcare provider's advice about fluid intake can all support your overall health. However, never start or stop medications, including water pills, without medical guidance. So far, we've covered fatigue, changes in urination, and swelling, 3 warning signs that are often mistaken for normal aging. But the next symptom surprises many people because it appears on the skin rather than in the kidneys themselves. In the next part, we'll explore why persistent itching may sometimes be linked to declining kidney function. Have you ever noticed that your skin feels unusually itchy, even though you use moisturizer and don't have a rash? Many older adults assume dry, itchy skin is simply another part of aging. While aging can make the skin drier, persistent itching that doesn't improve may sometimes be linked to declining kidney function. Healthy kidneys remove waste products and help keep the right balance of minerals, such as calcium and phosphorus, in your body. When the kidneys aren't working properly, waste and minerals can gradually build up in the bloodstream. Over time, this imbalance may contribute to dry, irritated, or persistently itchy skin. Some people describe the itching as mild at first, while others say it becomes worse at night, making it difficult to sleep. Imagine watering a garden with dirty water instead of clean water. Over time, the plants begin to suffer. In a similar way, when waste builds up in the body, your skin may start showing signs that something isn't right inside. Of course, kidney disease is not the only cause of itchy skin. Allergies, eczema, diabetes, liver disease, certain medications, and even cold weather can also lead to itching. That's why it's important not to jump to conclusions. However, if persistent itching occurs alongside fatigue, swelling, or changes in urination, it's worth discussing with your healthcare provider. Simple steps, such as staying hydrated, using fragrance-free moisturizers, avoiding very hot showers, and wearing soft cotton clothing may help relieve dry skin. But if the itching is severe, widespread, or continues for weeks despite good skin care, medical evaluation is important to identify the underlying cause. We've now covered several warning signs that may appear long before kidney disease becomes advanced. But the next symptom often affects your appetite, and many people don't realize it can also be connected to kidney health. Have you noticed that food doesn't taste as good as it used to? Perhaps you feel full after just a few bites, or you occasionally feel slightly nauseous for no clear reason. Many older adults assume these changes are simply part of aging. But when appetite steadily decreases without an obvious explanation, your kidneys may be sending an important message. Healthy kidneys continuously remove waste products from your bloodstream. When kidney function declines, these waste products can begin to build up over time. This buildup may affect the digestive system, leading to a reduced appetite, an unpleasant metallic taste in the mouth, bad breath, or mild nausea. As these symptoms develop gradually, many people hardly notice the changes until they begin losing weight or feeling weaker than usual. Imagine your home's garbage collection stopping for several days. Even if everything looked normal at first, the waste would slowly accumulate and affect the entire house. In a similar way, when the kidneys cannot efficiently remove waste, the whole body can begin to feel the effects. However, it's important to remember that poor appetite and nausea can have many causes. Stomach disorders, infections, medication side effects, depression, liver disease, and digestive conditions may all contribute to these symptoms. That's why ongoing appetite loss should never be ignored or simply blamed on age. If you've unintentionally lost weight, frequently skip meals because you're not hungry, or experience nausea that lasts more than a few days. Speak with your healthcare provider. They may recommend blood tests, urine tests, or other evaluations to determine the underlying cause. Maintaining kidney health also means nourishing your body. Try eating smaller, balanced meals throughout the day, staying hydrated if your doctor allows it, choosing fresh fruits and vegetables, limiting highly processed foods high in salt, and following any dietary advice given for your specific health conditions. So far, we've discussed several subtle warning signs that often appear early. In the next part, we'll explore another major clue that many people never connect to their kidneys: high blood pressure, often called the silent partner of kidney disease. High blood pressure is often called the silent killer because it usually causes no obvious symptoms. But did you know it also has a very close relationship with your kidneys? In fact, high blood pressure can both damage the kidneys and be caused by kidney disease. This creates a cycle that can slowly worsen over time if left untreated. Think of your kidneys as millions of tiny filters filled with delicate blood vessels. Every minute, these filters clean your blood by removing waste and extra fluid. When blood pressure stays too high for months or years, it places extra force on these tiny vessels, gradually damaging them. As the filters become less effective, the kidneys struggle to do their job, allowing more waste and fluid to remain in the body. The opposite can also happen. When damaged kidneys cannot properly control fluid and hormones that regulate blood pressure, your blood pressure may rise even higher. This is why doctors often check kidney function in people with long-term hypertension, especially those over the age of 60. Many people are surprised to learn they have high blood pressure because they feel perfectly fine. Others may experience occasional headaches, dizziness, blurred vision, or fatigue. But these symptoms are not always present. That's why regular blood pressure checks are so important, even if you feel healthy. Imagine two people in their 70s. One checks their blood pressure every few months and works with their doctor to keep it under control. The other rarely checks it because they feel fine. Years later, the first person may still have healthy kidney function, while the second discovers significant kidney damage that developed silently over time. This example shows why prevention is so valuable. The good news is that small daily habits can make a meaningful difference. Eating less sodium, staying physically active, maintaining a healthy weight, avoiding smoking, limiting alcohol, managing diabetes, and taking prescribed blood pressure medications as directed can all help protect your kidneys. Never stop blood pressure medication without speaking to your healthcare provider first. We've now explored several warning signs and risk factors that often go unnoticed. In the next part, we'll look at who is most likely to develop kidney disease and whether you may be in a higher risk group without realizing it. The good news is that protecting your kidneys doesn't usually require dramatic changes. In many cases, it's the small habits you practice every day that make the biggest difference over time. Just as healthy habits can strengthen your heart and muscles, they can also support your kidneys as they work around the clock to keep your body in balance. One of the most important habits is staying well hydrated. Water helps your kidneys remove waste and maintain the right balance of minerals in your body. However, hydration needs vary from person to person, especially if you have heart failure or advanced kidney disease. Always follow your healthcare provider's advice about how much fluid is right for you. Another key habit is limiting excess salt. Too much sodium can raise blood pressure and make the kidneys work harder than they should. Choosing fresh foods instead of highly processed meals is a simple way to reduce your salt intake. Regular physical activity also plays a powerful role. Even a 30-minute walk most days of the week can help control blood pressure, improve blood sugar levels, support a healthy weight, and reduce stress, all of which benefit your kidneys. Don't forget the importance of regular health checkups. Simple blood and urine tests can often detect kidney problems long before noticeable symptoms appear. Early detection gives you and your healthcare team the best chance to slow disease progression and protect your long-term health. Finally, be careful with over-the-counter pain relievers. Frequently taking medications such as ibuprofen or naproxen without medical guidance may increase the risk of kidney damage, especially in older adults or those with existing kidney disease. We've covered the warning signs and the habits that support healthy kidneys. In the final part, we'll bring everything together and discuss when it's time to seek medical care and why acting early can make all the difference. One of the biggest mistakes people make is waiting until they feel seriously ill before seeking medical advice. Unfortunately, kidney disease often develops slowly and quietly. By the time severe symptoms appear, significant kidney damage may have already occurred. That's why recognizing the early warning signs and acting on them is so important. You should consider speaking with your healthcare provider if you notice persistent fatigue, swelling in your ankles or feet, frequent nighttime urination, foamy or bloody urine, ongoing nausea, loss of appetite, or itchy skin that doesn't improve. These symptoms don't always mean you have kidney disease, but they deserve proper evaluation, especially if more than one occurs together. If you have diabetes, high blood pressure, heart disease, or a family history of kidney disease, regular kidney screening is especially important. Simple blood tests can measure how well your kidneys are filtering waste, while urine tests can detect protein or blood that may signal early kidney damage. These tests are quick, widely available, and can often identify problems long before you feel sick. It's also important to seek immediate medical care if you experience severe swelling, sudden difficulty breathing, chest pain, confusion, or a dramatic decrease in urine output. These symptoms may indicate a medical emergency that requires prompt attention. Remember, early detection doesn't just help protect your kidneys, it can also reduce the risk of heart disease, stroke, and other serious complications. The earlier a problem is identified, the more treatment options may be available. In our final part, we'll bring everything together with a simple summary of the key warning signs and the most important steps you can take to protect your kidney health for years to come. As we come to the end of this video, let's take a moment to remember one important message. Your kidneys often give quiet warnings long before they stop working properly. The challenge is that many of these signs are easy to mistake for normal aging. Feeling tired, waking up several times at night to urinate, swollen ankles, itchy skin, poor appetite, nausea, or high blood pressure may seem unrelated, but together they can tell an important story about your health. The encouraging news is that kidney disease doesn't always progress quickly. In many cases, early detection and healthy lifestyle changes can help slow the loss of kidney function. Regular checkups, blood pressure control, diabetes management, staying active, eating a balanced diet, avoiding excessive salt, and following your healthcare provider's advice can all make a real difference. Remember, this video is meant to help you recognize possible warning signs, not to diagnose kidney disease. Only a qualified healthcare professional can determine the cause of your symptoms through the right examinations and tests. If today's video taught you something new, don't keep this information to yourself. Someone in your family or a close friend may be ignoring these same warning signs without realizing their importance. Sharing this knowledge could encourage them to seek medical advice earlier. Now, we'd love to hear from you. How old are you, and which warning sign surprised you the most? Share your answer in the comments below so we can learn from one another and build a supportive community focused on healthy aging. If you found this video helpful, consider subscribing for more evidence-based health tips designed especially for adults over 60. Every week, we explore practical ways to protect your brain, heart, kidneys, muscles, and overall well-being, helping you stay healthier, more active, and more independent for years to come. Thank you for watching, take good care of yourself, and we'll see you in the next video.